Hey everyone, Dr. Yap here. I've got Drake with me. He's one of our talented team of kinesiologists here we have at the clinic. Today we're going to go over an exercise specific to address shoulder stability, but more so pelvic and hip stability with low back pain patients. This is a variation of the side plank exercise, also adopted from the DNS Low Oblique Sit position. So, to set it up, Drake here is going to start on his right side down. He's going to assume a position where his bottom knee is bent, top knee is also bent with the foot slightly in front of the shin. Now, you can play around with the angle of which you like. Feel what's comfortable for you, because everybody has different tightness or limitations in their hips. So find a position that's comfortable for you to get in to start. Feet pointing forward, and you're going to get on your elbow, making sure that your elbow is lined up with your hip bone. So Drake, why don't you come back a little bit right there. And with regard to where your hand position is, you don't need to be dead center on like how Drake is. You can also open up out to the side. But the goal here is that you are not resting on the tip of your elbow, but rather you're assuming a gentle, almost like a tricep press, as you press the entire outside of your forearm down and into the ground. Setup is important because we believe quality over quantity. Now, while you're in this position, your hand can go here, or you can put your hand in a C shape and place it right around your side, just above your pelvis or your hip bone. This is so we can making sure that we're cueing proper intra-abdominal pressure, or 360-degree breathing throughout this entire exercise. From here, you want to push your armpit and your rib cage away from the ground and not sag into the shoulder. So Drake, can you show us what sagging into the shoulder looks like? So this is not an ideal position. What we want is to engage the forearm through the floor, push armpit and rib cage away, and then from here, you want to hinge the shoulder slightly backwards to get a little bit more of the posterior cuff activation. If you notice, if you push the shoulder forward, you tend to lose the fullness in the back of your shoulder or your posterior deltoid. So hinge at the shoulder, backwards, right there. From there, assume a long, elongated spine with a gentle chin tuck. That's step one. Step two, Drake is going to push the outside of his knee down into the floor and assume a mild turning of his hip, like he's going to go into a crawl position. But instead, you're just going to press and lift up right there. Key points to this exercise as you hold this is to make sure that your sternum and your belly button are in the same plane. So there is a tendency for most of us to, as we come up into this hip hike, is to turn the pelvis pointing upward, meaning the belly button is now pointing up to the sky and the sternum is pointing straight ahead. So you want to make sure you line those two positions up. Head looking straight, good work. Aim for 20 to 30 seconds in this position. If you find a lot of excessive shaking in this position, work with 5 to 10 second holds. Work your way through this. You should not feel any low back pain, but rather a lot of demand and work through the downside shoulder as your support, downside glute, and proper breathing through your 360 abdominal core bracing. Go ahead and relax. That is the side plank variation, or adopted from the DNS Low Oblique Sit position. Thanks for watching, guys. Have fun, and we'll see you in the next video.